Hello, Psychmates! Welcome to this Brain Power Unleashed video where we talk about mental health and well-being, how we can manage stress. Mental health is a state in which individuals realize their potentials, can cope with the normal stresses of life, can work productively and fruitfully, and are able to communicate to the community. Mental health includes feeling, thinking, and acting. Mental health is a level of psychological well-being or an absence of mental illness. It is a state of someone who is functioning at a satisfactory level of emotional and behavioral adjustment. But it isn't always possible for us humans to just function at a satisfactory level of emotional or behavioral adjustment all the time, as we too get tired, encounter problems, experience unavoidable burnouts, which eventually lead to us experiencing stress from time to time. Especially now that we are battling a pandemic, we all are under a great stress. According to Interagency Standing Committee, in any health crisis, it is common for individuals to feel stressed and worried. Yet, what is stress? Stress is a feeling we have when we are under pressure. It is the body's way of responding to any kind of demand. Stress can be experienced from one's environment, body, and thoughts, and it can also be a good thing or bad. And it is a normal part of life. As stress is our body's way of responding, it has been a normal part of our lives. Stress can be positive or negative. Positive stress or eustress is a good and useful kind of stress evoked by positive events, while negative stress or distress is a bad kind of stress evoked by negative feelings. As it is normal for us to experience stress, the ones we experience can be classified as eustress or distress. Also, if there is stress, there are also reasons why we experience this. They are called stressors. Stressors are the events that provoke stress. They can be threatening, scary, worrisome, or thrilling. Some stressors include relationship issues, deadlines, living in a difficult circumstance such as living in the middle of a pandemic today, financial stress, unrealistic expectations of yourself or others, and taking too much at one time. These are only a few of the stressors we face on a daily basis. Now, the inability to adequately cope with stressors may pose a threat to our mental health. It is really frightening as this situation may cause us to develop certain conditions or disorders. That's why it is important for us to develop ways to cope up with the stress that we experience. So, what happens to the body when we are experiencing stress? First, we go through the fight or flight stress response. This is a natural reaction of the body to stress. With this, we undergo physical changes that prepare us to react quickly and effectively to handle the pressure of the moment. When our body is under stress, the hypothalamus signals the adrenal glands to produce more of the hormones adrenaline and cortisol and release them into the bloodstream. These hormones speed up the breathing rate, heart rate, blood pressure, and metabolism. Blood vessels open wider to let more blood flow up to large muscle groups, putting our muscles in alert. Our pupils dilate to improve vision. The liver releases some of its stored glucose to increase the body's energy. Sweat is produced to cool the body. Digestive activity is inhibited. Bladder is relaxed. The body's stress response enhances a person's ability to perform well under pressure. The nervous system quickly returns to its normal state, standing by to respond again when needed. But the stress response can also cause problems when it overreacts or fails to turn off and reset itself properly. Physical warning signs include tension, headaches, muscle aches, digestive difficulties such as upset stomach or ulcers, extreme fatigue, shortness of breath, sweating or shaking, and existing health conditions might become exacerbated or more challenging. Emotional warning signs include irritability, restlessness, feeling discouraged or hopeless, wanting to isolate, having difficulty concentrating, and feelings of panic and anxiety. Behavioral warning signs include difficulty with sleep, inability to relax or distress, anger issues, trouble with decision making, increased use of self-medicating approaches such as alcohol and other drugs, and overeating or not wanting to eat at all. Relational warning signs include communication difficulties, avoiding others or withdrawing, working long hours, and avoiding interaction or communicating with people. Chronic effects of stress include hypertension, coronary heart disease, stroke, anxiety disorder, and peptic ulcer. Also, some of the warning signs that we have to look out for during this pandemic include social withdrawal, hopelessness, sleep disturbance, unable to get pleasure, feeling exhausted by little things, difficulty concentrating, and appetite disturbance. Overcoming such overwhelming things wouldn't be easy, but we can minimize it with stress management. According to Gale Encyclopedia of Medicine 2008, stress management is a set of techniques and programs intended to help people deal more effectively with stress in their lives by analyzing the specific stressors and taking positive actions to minimize their effects. Before we move forward to the stress management techniques and strategies, there are factors to consider for a stress management plan as suggested by the American Psychological Association. These include understanding your stress, identifying your stress sources, learning to recognize stress signals, recognizing your stress strategies, implementing healthy stress management strategies, making self-care a priority, and asking for support when needed. And now that we know the factors that we need to consider, we can now proceed to our stress management techniques and strategies. First approach is the action-oriented approaches. This allows us to take action and change the stressful situation. One of the approaches that we can do under action-oriented is being assertive. In being assertive, clear and effective communication is the key. You can ask for what you want or need and explain what is bothering you. It is about being fair and firm while having empathy. You have to communicate clearly what you want and don't want in order to properly manage stress. Next thing that we need to do is reduce the noise. Switching off all the technology, screen time, and constant stimuli can help you slow down, as it is important to make time for some quietness each day. Recharging is an effective way to tackle stress. Another one that you can do in minimizing your stress is managing your time. It is important that you prioritize and organize tasks and do not allow yourself to be overwhelmingly busy, as it will lead to burnout. One important thing that we usually forget but badly needed to do is to create boundaries. By creating boundaries, you create internal set of rules that you establish for yourself. They outline what behaviors you will and won't accept, how much time and space you need from others, and what priorities you have. Setting boundaries mean you respect yourself and take care of your well-being. Lastly, you also need to get out of your head. Distract yourself from time to time by watching a movie or series, phoning or catching up with a friend, going for a walk, or doing something positive that you know takes your mind off things that stress you out. Next approach that we can use is the emotion-oriented approaches. This is used to change the way we perceive stressful situations. One thing that we can do under emotion-oriented approaches include affirmations and imagery. When you think of a positive experience, your brain perceives it to be reality. So let us replace negative thoughts with positive statements. We can also apply cognitive restructuring. It is a psychotherapeutic process of learning developed by Albert Ellis, where we understand the negative emotions and challenge the sometimes incorrect beliefs that cause them. There is also this ABC analysis technique that we can utilize. A stands for activating event, adversity, or stressful event. B is the beliefs or the way you respond to the event. The C is the consequences or the result of your beliefs that lead to actions and outcomes. ABC tells us that more optimistic beliefs lead to more positive outcomes. Last approach that we can use in battling stress is the acceptance-oriented approaches. This is useful in stressful situations that you cannot control. It is in this approach that diet and exercise fall under. It is important to be mindful of having a balanced and healthy diet. Exercise is proven to also be as effective as antidepressants in relieving mild depression. Aside from diet and exercise, we can also have meditation and physical relaxation. Deep breathing, guided visualizations, yoga, and guided body scans help relax the body. We also have to build resilience. Resiliency is the ability to bounce back from stressful or negative experiences. Resilient people are skilled at accepting the situation has occurred. They learn from what transpired and then they move on. We also have to talk it out. Sharing worries can cut them in half. And if you don't like sharing, writing them down is also a great way to release them. Talking to a professional can also help. Lastly, one of the important things that we treasure as a luxury is sleep. Sleeping is fundamental for recharging and dealing with stressful situations in the best possible way. In life, we go through different things, we respond to situations differently, and we handle them in our very own ways. The things I've shared in this video may be overwhelming, but I want to tell you that in facing whatever things that come your way, always remember to take care of yourself. It doesn't matter if you can't and don't use everything, a small step is still a progress. And I want to remind you that you are valued and loved, and there are people out there that can listen to you if you need someone to talk to.